Welcome back to Kiryandongo district. It's like we never left. We are still here and we're talking about the plight of refugees. And of course, I still do have my sergeant at arms, none other than Wilson Samuel, yes, and also the clerk, that is Hayati Sidonia. Thank you so much for holding forward. It's been now the next Saturday. You understand? First episode was done last Saturday. So this Saturday, we are still here talking about the same problem, mental health and psychosocial support systems for youth with disabilities. And we are at Kiryandongo Refugee Settlement, home to 77,000 refugees. Of course, this country is not home to only 77,000 refugees. It's a whopping 1.5 million refugees. In 2020, it was 1.4 million refugees. But of course, because of the displacement of people, because of natural disasters, the wars and conflicts you're seeing in neighboring Southern Sudan, the Democratic Republic of Congo, we had refugees streaming into the country in droves. So we do have some 1.5 million refugees. So today we are still focusing on Kiryandongo Refugee Settlement, home to some 77,000 refugees in the brigade. The mental health and psychosocial support for the youth with disabilities within this area. We are going to hear it from the International Rescue Committee. We do have a representative of this organization. By the way, your name please?
Honorable Speaker, all protocols observed. By name, I am Aseroneli. I work with IRC, International Rescue Committee.
Perfect.
The leading partner providing health services and medication to the refugees and the host community in Kiryandongo settlement. We work hand in hand with Office of the Prime Minister. We work with the district of Kiryandongo and our leading partner, our donor, who is UNHCR. As IRC, how have we ensured inclusivity of PWDs in the settlement of Kiryandongo? There are a lot of things that IRC, together with other implementing partners, that have been facing and has been as an obstacle to the PWDs from accessing services from the facilities. And one of them is the stigma that everyone has been talking about. Stigma towards the PWDs has been at a high rate, that the social connection has been cut off. The support to them to access the facilities has been cut off because of the social norms that are being taken up by the community persons. These people are taken as curses. They are not valued, they are not important, they are worthless. So some of them who cannot access services to the facilities are not supported. So accessing services to the facilities has been challenging them because they don't have a focal point. They don't have the voice and they can't come. And even if they come to the facilities, there is no priority to them, given to them by the facilities. As a case in point, are the OPD, are they given priorities to support them get access services immediately as they reach? Are the facilities accommodative enough to these persons of concern, both the mentally ill and disabled? Are the communities are the structures having ramps whereby this disabled can access it easily? Are the washrooms having supportive gadgets to support them? And the community structures that mainly we work with are the VHTs in the community. Are the VHTs having a supportive idea and towards the PWDs and the mentally ill people to support them come access services at the facilities? So those are the challenges that are cutting across. As I wrap up, as IRC and other partners whom will provide health services with, how are we negating these issues? One, we are making sure that the facilities which are newly constructed have ramps, have supportive gadgets in the washrooms to accommodate these persons of concern. We have the psychiatry department working with other organizations that work in hand in hand to support the mentally affected people so that they can access services. And according to the big gap of stigma, together with the other partners, we are doing consecutive community awarenesses, sensitizations, dialogues on how the community should cut the gap, should embrace these people, should bring these people on board so that they can be supported. A case in point that I would wish to end with, mentally ill people are really being avoided, that you reach sometimes in the community and they are caged by their own people.
Wow.
That they don't want to be exposed in the community, they don't want to be known. So because they affect their families.
So based on the field research you've done, would you say that this problem is higher in the refugee settlements and lower in the urban centers, or vice versa?
Apparently, I wouldn't have those evidences on my tips.
Well, thank you so much for that submission. Couldn't be more
You're
appreciative
welcome.
for your time. And of course, we would also like to hear from Nwodu. Yes, there she is. Come and talk to us. We are talking about the invisible disability, which is mental health. Your name, please?
Okay, thank you, Honorable Speaker. The House at large, protocol observed. My name is Murumbira Dina. I work with National Union of Women with Disabilities of Uganda.
Indeed.
I'm based in Kiryandongo here, and we are implementing a partnership project with BRAC and Humanity Inclusion. So one of the challenges today is mental health. So youth with mental health are facing so many challenges. One of them is sexual abuse. People will use their disability
You can go to the middle here so that the camera can be able
sexually.
to see. Perfect.
Like,
Just look in the camera.
Like an example, we have a girl with mental health in Chugumba. She was raped, but the family realized after like 2 months pregnant. So she was unable to point who did it to her. So in this, she was like when we came in, she was like pointing a certain home. But because she has mental health, people were like, oh no, how can I do this? How can I do this on this one? The family she pointed, everyone was arrogant. So with that, the family is unable, and we are unable as Nwodu to help her access justice, because we cannot just go to the family and begin pointing. So people are using the disability to gain their other. So that is the challenge we have. Then another challenge still on mental health, the tablets are there, the medications are there, but you find that they are out of stock every time. And mostly they are in hospitals. So you find out that most youth with mental health are unable to go to Kiryandongo to access the tablets. So here I would request at least they should be brought to the health centers nearest to them, to their community, which are the health center 3s and other health center 2s, for them to access those medicines. Another challenge that persons with disabilities in Kiryandongo have is sign language. Here you will reach the community, someone is deaf, cannot talk, but still the family is unable to talk to the person. And even if this person is going to access justice, even if we support this person to access justice or health services, still the communication will be poor. Still the communication will not be understood by where she wants or he wants to get to access justice from. Here we have been engaging the government, the local government, at least to have to train one person in sign language, and they were promising they will have a budget for someone to be trained. At least that someone will be there to train other people, so that at least we can have that challenge catered for. Thank you so much.
So much indeed. And of course, we do want another. Yes, she didn't speak behind you. She didn't get to speak. Your name, please, and your submission. 4 minutes.
Thank you, Deputy Speaker, sir. Before you, I'm by name Honorable Nakalanzi Justin, representing persons with disability. Most of the challenges that have been mentioned, but the most one which have been facing within Kiryandongo, there's domestic violence, whereby people with disability, they are being denied to own properties in all homes. There's also little attention given to persons with disability, most of the mental health people in the hospitals. My recommendations, I'm requesting the government to help us to recruit the specialized doctor to attend the special people with needs in the hospital. Even at the district level, we don't have a sign language interpreter. Today I'm very happy we are having one here who is communicating to my fellow people with disability. But the whole district at large, we don't have even a single sign language interpreter.
Not even one in the whole of Kiryandongo.
Not only one. So I'm requesting the government to help us recruit one. And lastly, there is little allocation given to persons with disability according to finance. You find that when we are budgeting, every department budgets, but what is budgeted for persons with disability is too little to cater for them. So I'm calling upon the government at least to put hand to help the persons with disability.
Indeed, you've come with a wealth of information.
For God and my country.
With that humble submission, we've come to the end of the first segment of this interaction. We're going to go for a break. A second segment is in the offing. We shall talk to more members of the Trans-Cultural Psychosocial Organization to talk about what they are doing to actually alleviate the challenges we're talking about right now. Mental health and psychosocial support systems for our youth with disabilities. We'll be right back to the People's Parliament. Keep around. Welcome back, and you're still watching the People's Parliament. So today, we are still talking about the mental health and psychosocial support systems for the youth with disabilities. We are humbled to have the DHO within our presence. She spoke earlier as a citizen, but now we want her to speak in the capacity as the DHO, District Health Officer, to ably explain to us what are mental illnesses and the causes of the same, what are the most prevalent mental illnesses in Kiryandongo District, and what are the preventive measures in that regard. That will be 4 minutes.
Thanks so much. When we talk of mental health, this is an emotional, psychosocial, and psychosocial things which is coupled with one's thoughts, one's feelings, and one's action. In Kiryandongo here, we have the most 3 major mental health illnesses. We have epilepsy, we have depression, and post-traumatic stress disorders.
So which one of these is the most prevalent? Which one of these is the most prevalent in Kiryandongo District? Epilepsy.
Followed by depression.
Okay.
And post-traumatic stress disorders. But when we go to the settlement, we start from depression and PTSD.
Okay, just explain it to us in layman's language.
And when we look at the causes, most of them are injuries, we have infections, and of course other related to psychosocial problems like domestic violence, sexual abuse, at family level, and of course poverty is going.
Wow. And that is not Kiryandongo refugee settlement alone, it's the whole country.
I'm talking about Kiryandongo district, including the refugee settlement.
When we speak about preventive measures, what are some
When
of
we
those?
talk about preventive measures, one of them is that we need early
detection,
medical care, seeking medical early. Because when you go early, it is detected early, and therefore it can be treated. We need to continue educating our communities about these things.
Indeed.
And also we need to engage them in income generating activities. That's how the poverty level will go out. And also need harmonization with families to avoid domestic violence. And also need exercises. You know, when you are stressed and you go for an exercise, there is a way you relax. So we are urging that people, we must join hands. It is not only, mental illnesses are not only for health department, they are for everybody, because they are identified from the community. All issues start from the community. And therefore I'm calling upon all stakeholders that we should join hands and ensure that we reduce on this. We do measures, we implement measures which will reduce on the impact of these mental illnesses. And on top of that, as a challenge, our health facilities do not have enough mental health workers.
Indeed.
In Kiryandongo Hospital, our major hospital, just maybe a week or two, that's when they have recruited another staff. We only had a psychiatric nurse. Now we have recruited a medical clinical officer. Thank for our health center 3, Panyadol Health Center, which is in the settlement. At least for them, we had clinical nurses, psychiatric nurses, and clinical officers.
Issues to do with funding.
Issues to do with funding, issues to do with the wage bill, issues to do with standing
Thank you so much.
norms, staffing norms. But ideally, we are supposed to have at least a psychiatric clinical officer at a level 3, at least, and if not a clinical officer, at least a psychiatric nurse.
Right.
So we still have those challenges. And maybe if government will come in, that is central government, to attract and post our districts.
Perfect.
Thanks so
Thank you
much.
so much. When it comes to issues of psychosocial support, please, it starts with caring. Just care. In the 1990s, we didn't have psychiatrists and so many of these people within this country, but communities cared. People in the community would just speak to a distressed young person. They find you walking on the street and just talk to you. Young man, what is happening? How can I help you? Nowadays, that is not happening. As long as it's not your child, it's not your brother, it's not your sister, people do not care anymore. We need to care again. It's part of the psychosocial support systems that we are talking about. Communities stepping up and also actually caring.
Thank you.
And of course, we do have leaders within our midst, the RDC, Resident District Commissioner for Kiryandongo, Mr. Muganga. Thank you so much for joining us. Dan Muganga is going to tell us what is being done by the leaders to iron out this problem. Go ahead. Podium is yours.
Thank you very much. The People's Parliament, my name is Dan Muganga, the Resident District Commissioner Kiryandongo. I'm 3 days here. Yes, yesterday I met a family member whose relative is being chased from a house because he's mentally sick. So in terms of conflict resolution, I have already directed the internal security officer to lead the mediation team to ensure that the mentally disturbed person is not evicted from his residence.
Wow. Before you came through into this position, were these cases rife? Were they many, numerous, if you will?
Yes, the cases are here. I've been transferred here. It's not
the same
new.
case of this disabled person being evicted.
Yes.
Before you came into office, had you heard from your officers, people giving you intelligence information that it was a big problem in the area?
Yes, it was an issue which I think the police was trying to handle. So instead of, I think the mentally disturbed person ending up attacking some people.
Wow.
But we are trying to prevail over.
Of course, that can't justify an eviction.
Prevent calm.
What else?
Yeah, generally in security, we are looking at most of these causes as the causes of mental illnesses, which we interact with. Some of them are causes of civil conflict, especially the refugees who have suffered civil wars in their countries, being dislocated from their families, accident victims, survivors from accidents who lose their friends and loved ones in accidents, they get mentally disturbed.
Indeed.
Drugs and alcohol abuse, epilepsy has been talked about, but then there are those who inherit genetics. There are people who inherit from their parents. Childhood trauma.
Inherit?
Yes.
Inherit what? The depression?
Disorders, yes.
I see.
Yes, they get
Go
it
ahead.
from some of the illnesses that are passed on to the children. Stress and losing loved ones. Then negative thoughts. People naturally thinking bad, negatively over
If
certain
poverty is
situations.
biting me at my
Yes,
household
yes.
and I'm
Yeah.
really angry, am I
Yes.
being negative?
You get out and
Or I'm
sit
reacting to
outside.
my condition.
Get out and sit outside your house. Or whatever you're thinking or whatever passes around is negative in your mind. And in the end...
So what are you as the leaders doing to alleviate the poverty that is increasing the mental health illness?
Good. Generally, our interventions as a local government are towards all the persons with disabilities. And here we have been funding. Kiryandongo is already injected 60 million shillings into a Myoga program specifically for persons with disabilities.
Oh, nice.
We have 2 constituencies, and in each constituency 30 million has been injected into PWD groups. There are also other funding, the National Special Grant for PWDs, 15 groups being funded at a tune of 75 million shillings. And then we are also supporting associations and persons with disabilities like wheelchairs and linkages and then sensitization. I think you will give a chance to our community development officer.
Yeah.
Who will...
in the second segment, he's around here.
Yes,
he's going
yes.
to speak, plus the LC.
Yes, but we are also looking at skills development in persons with disability groups, supporting skills development. Disability is not inability. So we make sure that our disabled persons are grouped and trained. The political leaders, the district chairperson, will give you examples of PWDs who have been incorporated into leadership and committees to ensure that they are not left out. I want to thank you for this intervention.
Indeed.
But in the security circle, we ensure that we give them affirmative action when they come with issues. So thank you very much.
Thank you so much too, Mr. Dan Muganga. 3 days in office and he's doing so much. And of course, that's it for this second segment of the People's Parliament. We do have a third segment that is coming and it's in the offing. In this third segment, we would like to talk about the recommendations, solutions to the problems that have been aired. Last Saturday, we had problems that were shared here in this People's Parliament. This Saturday still, we've had problems being shared within this People's Parliament. So what are the solutions? Can we get some kind of solutions? But of course, before we get to the solution stage in that second segment, we shall hear from the Community Development Officer and also the LC5 chairperson for the region. But for now, let's take a break, return shortly. Keep around. Welcome back to the People's Parliament. The theme for this conversation is mental health and psychosocial support systems for the youth with disabilities. You did hear before we broke off from the RDC4 of the area, that is Dan Muganga.
Thank you so much, Mr. Speaker.
Indeed.
And this Honorable August House for the discussion of today, mental health.
So we'd like to talk about the measures you've put in place to address the barriers to access and also the provision of mental health and psychosocial support systems in Kiryandongo district.
Yes.
What have you done to address the barriers?
As a district, we have addressed the barriers in many ways. When we have the Mental Health Day,
Indeed.
we are all there to advocate.
Only on the Mental Health Day?
Yes.
Only that's when you're visible?
I am continuing, Mr. Speaker.
All right, go ahead.
When we have the Mental Health Day, we are always there to advocate for the mentally ill people.
All right.
And also to learn how to identify them, how to attend to them, and what government can do more
All right.
to support the mentally ill people.
All right.
We've not only done that, we've gone to the community and sensitized the community about mental health.
Okay.
And especially looking at the end root, the causes of mental health. When you study our environment, many of our children today are drug addicts, chewing mairungi, they are eating opium.
I saw like 50 on the streets, idly doing nothing but just on the
They are
street.
eating opium and all that.
So
that
as a
amounts-
leader, when you move around and you see these young people idly just sitting around doing nothing, what comes to your mind? What quickly do you do to intervene? Do you just look at them and say,
we
have a
have
big
made
problem?
interventions, Mr. Speaker, sir. We have brought religious leaders, the cultural
I
leaders,
see. To talk to them.
to talk to them at church level, to talk to them at the mosque.
We have
But
come
we're
up.
talking about a group of people who do not go to church or mosques.
Yes, there are others who don't go to churches and mosques, but we have also had interventions of community sensitizations and dialogues. Many times when we are talking about GBV, we also sit and talk to the community at playgrounds and other areas,
Indeed.
and we integrate GBV with mental health.
Nice. And of course, we are talking about mental health. And the young people that I saw, the 50 young people who are idling on the streets, we could say they are disabled because they are grappling with mental illnesses. But didn't you say that your office has failed, given the fact that you still have a big problem on the streets that is evident for everyone to see? Even right now, if you walked out, you would see these
It
young
is
people on the
true.
streets.
Even right now, even the mad people, it emanated from that.
I see.
And indeed, as you said, we have so many mad people along the streets in many towns, coming right from Masindi Port up to Karuma.
Indeed.
And the other problem that now we have with the mental ill people is having them supported for rehabilitation.
Indeed.
How do they go to Butabika? Much as our as the TPO has said, we have a clinic, but some of our clinic there may not manage rehabilitation of such mad people.
Indeed.
They will definitely need referral to Butabika.
If we had a replica of Butabika Hospital in Kiryandongo district, would it help? Instead of referring them to a far-flung area. If we had Butabika and all, the
It
replication
would
of the
help
same in here.
if we had a unit, say at Kiryandongo General Hospital. Actually, we're advocating for Kiryandongo General Hospital to become a highway referral hospital. So if we had a unit at Kiryandongo General Hospital, it would help us from bearing the big burden which we cannot manage.
Indeed.
Like we need a vehicle, we need fuel, we need the support, the other side. And the other thing is...
And the president is watching all this, so really help is coming. Is it true that some people recover from this mental illness problem?
Yeah, there are some people who recover from illness. We have seen people who have been brought back home, who have recovered, and they are able to do the activities as normal human beings.
All right.
So we advocate that they be identified, training goes on, and we get them rehabilitated.
And indeed, thank you
back at
so
home.
much. And that's why the NTV
Treated.
People's Parliament is here. Thank you so much. That's why Y Global is here. IRC, Nwodu, Nudipu, we are here to help you, Kiryandongo. You will not suffer or work in isolation. Thank you so much. Even those in the host communities, by the way, go and seek psychosocial help. These NGOs are willing to work and interact with you. Y Global, IRC, International Rescue Committee, you do have Nwodu, Nudipu, all these organizations are at your disposal to give you all the help that you need. Members of the public, you also be raising your hands to just give us a recommendation on how best we can alleviate this challenge. Just a minute before you go. Recommendations.
Yes, in the recommendations, generally the funding for mental health programs is still low.
All right.
We therefore recommend the government, Parliament and the Ministry of Health to increase funding for mental health programs and also recruit more health workers specifically to handle the mental cases.
All right. Thank you so much, Dan Muganga. He's only 3 days old in his new position, but he's doing so much. He's the artist of the area. So it's open to the audience. If you do have a recommendation on how best we can deal with this problem, JJ Paul, you sent me a text. You wanted to say something. Come over to the podium and give us some recommendations.
Before I give my 2 or 3 recommendations, I want to make a presentation on... People have been talking of everybody having mental illness, but the degree varies. To me, I will specifically talk of those who have already gone out of hand. These are the people, to me, I feel I am very much concerned about them. And in the definition of person with disability, it is very clear that you will be able to find this under the UN Convention on the Right for Persons with Disability. Right. We are now talking about inclusion, and in this inclusion, we are meaning how do we really support someone with severe mental illness. Many have already talked about this. Take, for example, you have somebody on the street, and you can begin to imagine how long this person get to be talked to. Therefore, the one that are on the street with severe psychosocial need, even need communication. My specific advice is that awareness creation has to be at all level. When people were making submission, I was identifying, someone say, people with mental health. That is not a description of the person we are talking to. You can say somebody with mental health and psychosocial need. Someone was saying people who have gone bizarre. It is not that. We call them people who are the users of mental health services. These are the appropriate word we can describe to call them. Because when you say someone who has gone bizarre, that is already a stigma, which is not the rightful thing. So we are grateful to...
Wording is important. So thank you so much,
Wording is important.
for that submission.
Then another thing, support the person to meet his or her basic needs, which ranges from survival needs, participation needs, developmental needs. Thank you so much.
I love the enthusiasm though. Thank you so much, JJ. We also have a representative of the OPM. You wanted to give us a recommendation. Please, you do have 2 minutes to do so. And then we'll talk to this lady. There's a gentleman over there. Yes, you're going to speak to us.
Thank you, Honorable Speaker, for recommendation and way forward to improve on life of people with disability and mental challenged people. One, as a district and on behalf of OPM and to all settlements or district hosting refugees and the district, we should have a well-informed data to inform our planning, to enable to have proper intervention. It will help at the national level and at the district level. For example, we have Dr. Deep. This is a heavily funded project approach to support hosting district, of which, if we plan well, prioritize well our areas of key concern, like in education, we can establish a school which can support refugees and host community to enable the education of people with disability, than stretching to Gulu High for secondary and Masindi.
All right, thank you so much for that humble submission. We do have the young lady behind there. She would also be able to give us a recommendation in that regard. Nudipu is also itching to give us a recommendation. Of course, she's grappling with the disability. Someone please help her. Yes, indeed. And what other way to know the challenges facing people or youth with disabilities than to speak to a youth grappling with a disability herself? She'll be in a better position to explain to us the dire constraints that they go through on a daily basis. You can just lower the mic for her just briefly. Hi, how are you? What's your name? Hi. Yes.
Of the People's Parliament today, the audience present, I greet you all in the name of Jesus Christ.
Indeed.
I'm quoted in Naseje. I'm visually impaired, and I'm standing here as a youth from Kiryandongo district, Weyale. So I just have a few recommendations that I would love to pass.
Go ahead.
Honorable Speaker, my first point, we have to focus on mindset change in the community. You realize that the community's attitude towards the families of persons with disabilities, and the persons with disabilities in particular, those with mental health, have been stigmatized. And therefore, because the community has stigmatized them, you find that they have a loss of esteem and lack of confidence. So, when we change the attitude or the mindset of the community, I think something will be done. We have to advocate for the rights of persons with disabilities, in particular those with mental health, so that they are not violated. Honorable Speaker, my second point, I think we need a rehabilitation center within Kiryandongo district, and the government should put in place a special psychiatrist to take care of these people whenever they are brought to that center. I'm talking of those people with disabilities, with mental health in particular. Then, you realize that our families and the community at large has taken these people to become income generating to themselves. Therefore, more awareness should be done to the community, because you realize that these people, much as they are given support, the communities and the family members would not wish to see that these people change, because there is something they gain or they get out of them. So therefore, we should leave our comfortable chairs and come down to the grassroots.
Indeed.
And advocate for the rights of persons with disabilities. Honorable Speaker, my last point, for those people who have always sexually harassed persons with disabilities, in particular those with mental health, I think we should castrate them.
Indeed, we should castrate
them. So, I think with that, thank you so much, Honorable Speaker, for God and my country.
All right. Yes, we do have an elderly person within our midst who wanted to say something. Wow, that was a great submission. I was really moved. Thank you so much. This is your mic over here. Your name, sir? You do have a minute.
Yeah, right, Honorable Speaker. Protocol of the district observed, and those in the camp also observed properly. I'm here just giving a brief recommendation. My name is Alongerieni Juventine, a teacher at Chanrom. I'm representing the teachers or other schools in the camp. So I'm bringing people right down to the grassroots level of what is happening exactly in the classroom environment. And secondly, at the homes of these children as I observe them, because I'm so close to them always as a community leader. So now, when I start with the classroom pertaining the inclusive learning, I'm begging kindly that if it would be possible, right, Honorable Speaker,
Indeed.
it would be possible. These teachers need to be sensitized also. Workshops should be held for these teachers. We have got good tutors in the colleges.
They need to be trained.
And we have got good health workers who know what to do so that we reduce this amount of discrimination and whatever stigma it might be. So I can see it even when I see it among the teachers, I feel sometimes sorry.
Indeed.
As a teacher myself. Now then, at home, already I investigated so many parents. Yesterday, just there was one woman who was trying to alert me on how other children were playing a mockery on her child. At the same time, this woman has lost a husband. Whereby these camp women, as we see them, are suffering a great deal with their children. One woman can even have up to 3 children with disability. So I would recommend that if it be possible, the ratio which is given to these people should be increased and they should be prioritized. So that the people of disability or parents with disability children of disability should be prioritized wherever the ratio is being given, or their money be raised, or whatever food. Thank you very much. Right, Honorable.
Line in a long queue, they're not being
I don't want
priority.
that kind of character whereby they are pushed like this. The child at home is there, no one is caring for that child.
Thank you so much, indeed. That message has been drilled home. Like I said, the President, Museveni, is watching. NTV's People's Parliament, he loves this show. And of course, help is coming to Kiryandongo district and the settlement alike. Thank you so much for your submission. Of course, we do have a lady right there. The IRC has a recommendation for us. Like a minute, we've really run out of time.
It is high time the government at the central point embrace the fact that there is need of mental health and psychosocial support down on the grassroots. This is a gap that is there, and the government at the point has not given priority to ease. If you look at resource allocations, resources given to mental health and psychosocial support is very minimal, very little, that it cannot even support these people to to the capacity that they can be rehabilitated and embraced in the community. So it should start with the government. Government should embrace this, and with the support with NGOs, I believe we shall get better results in our country. Thank you very much.
Of course, there is a need to identify mental health as a bigger problem, even within the host communities, for people who haven't suffered war or natural calamities in that regard, or displacement within their communities, but they actually need that kind of mental health. Government needs to recognize that and actually help the NGOs that are working within that space. We'd also like to hear from Y Global. Yes, representatives from Y Global, the program manager, Isaac Okwi. He's still here with us. My humble gentleman, you do come over and explain to the audience and also the country that you do not only focus on the refugees, even the host communities are also catered for in your programs. The podium is also yours, Mr. Isaac Okwi. He's the program manager, Y Global.
Thank you very much, Mr. Speaker, and the audience members of the People's Parliament. In our approach, we do understand that the refugee communities that exist here in Kiryandongo have been accepted by the host community. And it's also very true from our finding that, yes, similar problems that the refugees are facing are also being faced by the host community. We are guided by the refugee framework, which has been set by the government of Uganda. And in undertaking our mandate, our responsibility, it is very true that, yes, we prioritize working with the refugees, giving them 70% beneficiary lots, just because of the level of vulnerability, being refugees who are living in a country which is not of their own, they really deserve more than another person. But we don't negate the fact that the host community also do face similar problem. That is why 30% of our support we give to the host community. And a case in point, the assistive devices that we have been giving last year, I think majority of so many people from the host community were able to benefit. It's very, very right for the RDC to call for the government to come up much and support where there are gaps. Yes, as NGO, we are just a drop in an ocean, and now that Y Global gives 30% to the host community, I think the government should come in to fill in other gaps, but also to advocate for other partners. We may get other non-governmental organizations that can come and give 70% to the host community and 30% to the
viewers
to the
who are watching
refugees.
and the people in the audience would like to know what kind of challenges, Mr. Okwi, you've gone through as Y Global while executing your mandate, extending mental health and psychosocial support to the youth with disabilities within Kiryandongo district.
The biggest challenge is relating to the overwhelming needs of the community. As NGO, we do not have that envelopes that is big enough to respond to the need of the people in the community, both refugees and host community. It is only the government that can really ably respond to some of these things. So the biggest challenge is the budget issues. Secondly, my brother, one of the persons, talked about operationalizing the policy. In regards to this debate, and as part of the closure, I want to emphasize on few recommendations. One is that it is very, very important for us development partners to look into enhancing the capacity of organizations of people living with disability. It is only through strengthening their capacity that they are going to be able to demand for what they feel is right for them, that they are going to be able to understand what is not right and what is right, and they are going to be able to champion the cause of bettering themselves. I also want to advocate, as part of recommendations, that we need to involve people with disability in the decision-making process. This kind of sitting is very important for them to communicate what they feel. When we get to planning this, it is important to involve them so that we hear what they think and what is right for them. So right at planning, it is very important. At programming level, how does our program fit into their needs? How disability-friendly is our program going to be? By simple mention of words, how do we call people with disabilities? Sometimes we end up stigmatizing them by the way we call them. So it is very, very important to be disability sensitive during planning program. Those are passionate recommendations that I want to leave this August House with. Finally, on behalf of Y Global, I want to say thank you to everyone who chose to be part of this debate. What you have spoken, we shall live to remember, and it's going to help in shaping the challenges that people with disability is facing. And most importantly, to NTV Uganda, we are happy to amplifying this debate to go national, and we are very sure that something positive is going to come up as a result of this debate. I thank you very much, and I wish you very well.
And of course, that brings us to the end of this edition of the NTV People's Parliament. I'm your humble speaker, Romeo Busiko, and I couldn't have been so humble to be in your midst. It was a great conversation that we had last Saturday, and this Saturday we are still here. Yes, have yourselves a blessed night. That's it from the NTV People's Parliament. Good night.